Good afternoon, everyone. Thank you for being here and amplifying these messages that we have to share today. We are in uncertain times, and that is no different at Food Bank of Alaska. So I'll start out today by offering a few numbers around what's happening with SNAP, and I'll talk a little bit nationally in a lot more states. So just for reference, Food Bank of Alaska since 1979 has been working in the state to end hunger, and we work with over 150 agency partners around the state who do last mile distribution to people in need. Last year, we distributed almost 8 million pounds of food through our network. We at Food Bank of Alaska are partnered with the Division of Public Assistance to assist Alaskans with SNAP applications. So we talk to our neighbors daily. Hunger has gone up in Alaska. We know this anecdotally from reports from our neighbors, and we know this from Feeding America's SNAP Meal Gap, where now 1 in 7 Alaskans are hungry, and that means 1 in 5 Alaskan kids. So this makes these cuts all the more urgent to talk about and to highlight. SNAP is an effective program. It nourishes almost 70,000 Alaskans, or that's 1 in 10. And we know that fraud is often a result of poor technology, poor program execution, and is often not on the recipient of SNAP. It's not about exploitation. So, and in the United States, the vast majority of SNAP recipients work. They are in working families. SNAP is good for Alaska, and it's good for Alaskans. In 2023, SNAP recipients in Alaska redeemed over $280 million in over 550 retailers in the state. So SNAP boosts local economies. We have significant concerns about the latest budget reconciliation language. Recently, this just released from the Senate Committee on Agriculture, Nutrition, and Forestry. Broadly, Food Bank of Alaska and our advocate partners are watching the SNAP program's cost shift to the state. We're watching the cost shift, restricted access to SNAP in areas with low employment opportunities, and increased burden on caretakers, as well as reduced access for foster youth, veterans, and people who are unhoused. Feeding America, the leading national anti-hunger organization, estimates these cuts could result in 9 billion meals lost a year from tables. For reference, they currently distribute about 6 billion meals through their network. This is a gap that cannot be filled in the programs that we have right now. So we know that program cuts result in increased traffic in food pantries and soup kitchens. Almost immediately, just yesterday, Hannah Hill, the executive director of Breadline in Fairbanks, said they had their busiest lunch service ever yesterday. So in our talk with Division of Public Assistance, Director Deb Etheridge, we estimate the proposed cuts as are currently right now in the language. The cuts and cost shifts will increase Alaska's annual budget by at least $47.5 million. That is just for the cost of the SNAP benefits and the additional administrative burden. If anyone has been following the ledge, we know we have a difficult time finding money right now in this state. So this feels insurmountable right now. The percentage of the cost shift for Alaska to pay for SNAP is based on our SNAP error rate. And unfortunately, Alaska is #1 in the nation. So that list would be highest percentage at 15% shift in food benefits, or in SNAP benefits, excuse me. This will make it exponentially more difficult for DPA to continue the progress they have made in reducing the SNAP backlog, implementing long-term technology solutions, better training eligibility technicians, and really working on the pieces of the program that make it so efficient and make it work for Alaskans. Finally, we recognize that our anti-hunger network does not exist in a vacuum. We are a critical part of Alaska's food system, our healthcare system, our aid systems, and we're concerned about the compounding effects of all of these cuts together. The language has been very concerning coming out about Medicaid, and we understand that a lot of people on Medicaid also access SNAP, and they're looking at a 1-2 punch. So we know that food is often the most flexible line in the household budget. We know that people do sometimes, they can't afford their prescription. They cut their nutrition budget because they have to afford their meds. They have to pay their rent, and they have to pay their heat. So I will leave it at there for questions, but that's what we have to say right now.